Assalamualaikum warahmatullahi wabarakatuh. Good morning everyone. Let me introduce myself. My name is Farida Mesa. What I want to do this morning is presentation about delivery a baby. My presentation about 10 minutes. I'll be happy to answer any questions you have at the end of my presentation. If we look at this slide, do you know definition delivery a baby? Okay, let me tell you what is delivery a baby. Delivery a baby is the ending of pregnancy where one or more babies leaves the uterus by passing through the vagina or by cesarean section. Labor is considered normal if the process occurs at term gestational age after 37 weeks without any complications. It begins when the uterus contracts and causes change in the cervix, opening and thinning, and ends with the delivery of the complete placenta. The mother has not been said to be in labor if uterine contractions do not result in cervical change and dilatations. Next, do you know what kinds of childbirth and delivery methods? Okay, let me tell you everyone. To start with vaginal delivery. In a vaginal birth or vaginal delivery, the baby is born through the birth canal. Benefits of vaginal delivery, there are 1. Shorter hospital stays, 2. Lower infection rates, 3. Quicker recovery, and 4. Babies born vaginally have a lower risk of respiratory problems. Then, what is cesarean sections? Cesarean section is the delivery of the baby through a surgical incision in the mother's abdomen and uterus. In certain circumstances, a C-section is scheduled in advance. In others, it's done in response to an unforeseen complications. Even that might require C-section, there are 1. Multiples, 2. A very large baby, 3. Previous surgery, 4. Baby is in breech or transverse positions, 5. Placenta previa, when the placenta is low in the uterus and covers the cervix, and 6. Fibroid or other large obstruction. Let's now move on to vaginal birth after cesarean, vaginal delivery after cesarean section or VBAC. In the past, a C-section ended any hope of future vaginal deliveries, but today, thanks largely to change in surgical technique, VBAC is possible in many cases. In fact, an estimated 75% of women who try VBAC have a successful vaginal delivery. VBAC isn't right for everyone though. Sometimes a pregnancy complication or underlying conditions prevents the possibility of a successful VBAC. Let's now turn to vacuum extraction. Vacuum extraction is a procedure sometimes during vaginal delivery. During vacuum extraction, a healthcare provider applies the vacuum to the baby's head to help guide the baby out of the birth canal. Finally, I'll be looking at forceps delivery. Forceps delivery is a type of operative vaginal delivery. In a forceps delivery, a healthcare provider applies forceps, an instrument shaped like a pear or large sponge or salad tongs, to the baby's head to help guide the baby out of the birth canal. To summarize, labor is the process by which the baby, placenta, and membrane are expelled from the mother's uterus. Finally, may I say Alhamdulillahirabbil alamin. Thank you for your attention. If there are any questions, I'll do my best to answer them. Assalamualaikum warahmatullahi wabarakatuh.